Assalamu alaikum and good morning towards everyone. Today I am here to present about our slide. As you can see here, I am the presenter, Muhammad Aisha Afkar bin Muhammad Ashraf. Well, my editor is Noor Arisad Damia binti Muhnordin. Let's get into our SDGs first. First one is SDG 3, good health and well-being. Raise awareness of hypertension to prevent heart disease, stroke, and kidney failure. Ensure affordable access to checkups, medication, and blood pressure monitoring. Trains more healthcare workers to detect and manage hypertension. Up next, we've got SDG 4, quality education. Educate communities on healthy lifestyles to prevent high blood pressure. Teach people how to measure and understand their blood pressure readings. Next is SDG 17, partnerships for goals. Collaborate with governments, NGOs, and private sectors for free screenings and campaigns. Work with food industries to reduce sodium in processed foods. And back to our topics. Understanding hypertension, a healthcare presentation. First of all, what is hypertension? Hypertension, or commonly known as high blood pressure, is a condition in which the force of the blood against the artery walls is consistently too high. Over time, this increased pressure can lead to serious health complications, including heart disease, stroke, and kidney problems. Blood pressure is measured in millimeters of mercury, or better known as millimeter Hg, and recorded as two numbers, systolic, the top number, and diastolic, the bottom number. Next, we've got blood pressure categories. According to standard guidelines, blood pressure levels are categorized as normal, which is less than 120 to 80 millimeters of mercury, elevated systolic 120 to 129, and diastolic less than 80 millimeters of mercury. Hypertension stage 1, systolic 130 to 139 or diastolic 80 to 89 millimeters of mercury. Hypertension stage 2, systolic 140 or higher or diastolic 90 or higher. And finally, we've got hypertensive crisis, systolic over 180 and or diastolic over 120 millimeters of mercury. Next, we've got causes and risk factors. Hypertension can arise from lifestyle and genetic factors, including an unhealthy diet, which is high in salt and saturated fats, lack of physical activity, obesity or being overweight, excessive alcohol or tobacco use, chronic stress, family history of high blood pressure. It may also be secondary to conditions like kidney disease or hormonal disorders. And then we've got symptoms and the silent nature of hypertension. Hypertension is often called the silent killer because it typically has no obvious symptoms until significant damage has occurred. When symptoms do appear, they may include headaches, shortness of breath, nosebleeds, or chest pain. But these are not always present and often appear when blood pressure is dangerously high. Complications of untreated hypertension. If left unmanaged, high blood pressure can lead to number one, heart disease, including heart attacks, heart failure, and left ventricular hypertrophy. Number two, stroke, due to weakened or blocked blood vessels in the brain. Number three, kidney damage, resulting in chronic kidney disease or failure. And last but not least, number four, cognitive issues, such as memory loss and dementia over time. Diagnosis and monitoring. Hypertension is diagnosed by measuring blood pressure with a cuff device. Multiple readings over time are needed to confirm a diagnosis. Some people may require a 24-hour ambulatory blood pressure monitoring. Regular monitoring is essential, especially for individuals at risk. Medications and medical management. When lifestyle changes are not enough, medication may be prescribed. Common classes of antihypertensive drugs include diuretics, medicines that help reduce blood fluid buildup in the body, ACE inhibitors or ACE inhibitors is medicines that lower blood pressure. And last but not least, calcium channel blockers stop calcium from entering the cells of the heart and arteries. A small tip, always take medication consistently and check blood pressure regularly to ensure effectiveness. And finally, onto our last slide, lifestyle modifications for management. Lifestyle changes are often the first step in managing high blood pressure. These include reducing salt intake and eating a balanced healthy diet, engaging in regular physical activity for at least 30 minutes most days, maintaining a healthy weight, limiting alcohol and avoiding tobacco, managing stress through relaxation techniques or therapy. That's all from me today. Thank you.